Welcome to the trigger point session of tonight's, I've got 8 modules going on. My name is Dr. Runne, for those of you who have not met me before, and for those who might be watching the video later. We're going to talk today about one of my, I guess it's one of these things that I love, which is trigger point therapy. And that's because it's such a simple thing that I think everybody should be able to know how to do, because you can get rid of a whole lot of pain with something as simple as push, hold, wait, and then do it again in a new spot. So we're going to go over this over and over, but I'm going to start out by saying all the videos that we're recording now on different topics like nutrition and healthy weight loss, which was the first one. We talked about probiotics and the gut last time. We're going to talk about the hydrotherapy on the next series. But all this is going to be available for free if you go text your name and email to the number here, or you can get on CalebRunne.com. That's my name, and that'll give you access to our free videos. So, all right, so let's get started. We're talking about trigger point therapy. I'm going to basically go over what that means, where trigger points come from. So in order to do that, we're going to start with the drawing. We're going to talk about muscle fibers. Muscles are made up of fibers, and then they're made up of bundles, and then they're made up of muscle groups. So each fiber is surrounded by what's called fascia. And so we're just going to pretend like the black is fascia and the red is a muscle fiber. All right, so you've got one fiber. Then these are in bundles, so we're going to have lots of these. And I'm not going to draw all of them, but we're going to give a basic idea here. Muscle fibers turning into a muscle when they got all combined together. And then we've got these layers of fascia, which is just connective tissue. What is connective tissue? It's kind of like skin. You can think of it as layer cells. So what will happen is we may fall down and injure ourselves and then have some sort of a tear, okay? Now, your body is not, when we lay down scar tissue, which is built to heal the torn ends, your scar tissue doesn't really have a brain. It doesn't know what to do exactly. It knows where to go, essentially. But when that happens, scar tissue, kind of like the fascia, is just kind of just laid everywhere in here. Okay, all directions. So, does its job. Fixes that cut or that tear in the muscle fiber. Now, over time, as you move, you're going to, your body's going to come in here, it's going to remodel, it's going to start to take away those fibers that don't really do anything, that kind of get in the way. And you'll get a fairly good replacement for what was injured. All right? That's the best case scenario. A lot of times we'll have an injury and it never heals well. And when that happens, you're going to have this scar tissue laid down all over the place. And scar tissue is different than muscle tissue. Muscle tissue stretches. Scar tissue doesn't. Scar tissue will heal an area, close it off, and over time it shrinks. You may have noticed when you get a cut on your skin. You can look at that cut, that scar, and it's pink and puffy at first. And over time, it shrinks. And it all disappears. Sometimes you forget you ever had an injury because you never see that scar anymore. Same thing happens on the inside of the body. The problem is we've got these contractile tissues, meaning it's going to shorten and it's going to stretch. So if you have something that's in there and it's cutting or shrinking and not allowing you to stretch quite as far, you're actually going to have that problem, just the problem that it's not stretching as far, and also you're going to have a problem where you're not going to get as good circulation going into the area. So this is going to lead to a problem that gets worse over time because the shrink occurs, you go through a normal range of motion, and you may create a new tear. It's like a brand new injury. This happens all over again. And then that scar starts to grow, and it, over time, takes over the function of this bundle of muscle fiber. Okay? Now, this is pretty basic. There are other areas that develop trigger points, like ligaments, like joint capsules. So it's not just in the muscle, but we're going to talk about the muscle because it's kind of the most easy to understand, I think. And we're going to be working with some of the easier things and some of the things that you guys are going to feel comfortable doing on your own. Does anybody have any questions about what I've talked about so far? Fairly clear. Injury, scar tissue, shrinks over time, can tear going through regular range of motion over time, creates new injury. Now, this is like, okay, we had an injury. Now we're going to talk about how trigger points can actually, we can look at some of these charts over here. You see these, you may not see, it's kind of far away. There are these little X's where there can be an injury to a muscle, and then where those injuries actually send pain to. So, for example, you can have an injury to your scaling muscles, which is on the other chart. So you can have an injury to the muscles here in your neck, and that injury will actually refer pain into the chest, into the mid-back, down into the arm, into the finger, and you might think, well, I got this pain here. Well, this is not where your problem is. Your problem is actually here. So if you can get rid of this, it helps correct this. Well, if you feel pain in an area, even if there's no direct injury, your brain will say, there's an injury here. Over time, it's going to say, well, let's go lay down some scar tissue because I feel like it hurts there. So I'm going to start fixing that problem. And now you've got trigger points developing in an area that was never originally injured. So those are called satellite trigger points. And that can be just as bad as an original trigger point, right? So you'll find maybe at first, oh, it hurts here, let me work on it here. And yeah, that will get better a little bit, but never gets completely well, because that's not where the original problem was. You got to go back to the source. So we've got these trigger points that send pain elsewhere. Now, that can lead to trigger points elsewhere. We're talking about that, the satellite trigger points. Now, we want to try and find the original source. And this is kind of where my expertise comes into play. Like I've studied these trigger points. I know how to work on them. I know where they're referred to. These are things that it's not magic. It's just something that I've learned over time. It's something that you can learn over time. There are resources for this stuff, like these charts. There are books. So what I want to do is try and help you become comfortable working on these yourself to a certain extent. So you may not know everything, but you can help yourself in many situations. So we're going to do that.
I have a question.
Yes.
Arthritis, is that also connected really to somewhere else?
Arthritis is, if we break down the word arthritis, means joint, arthrosis. Itis means inflammation. So if you got inflammation in the joints, then you're going to have pain in the joints. Oftentimes that's a misnomer. People say, well, I got pain in my elbow. That's arthritis. It might not be. It might be a referred pain from a trigger point. Otherwise, you might say, well, I got an x-ray taken and I had all these gnarly looking spurs coming off of my spine and they told me it's arthritis. Well, if it's not currently inflamed, then it's not really itis. It's like it's looking in the past. There was an injury there. It potentially is gone and left behind some traces. In the joints, it's going to look like bone spurs. It's going to look like growth in the joints. On the muscles, it's going to look like scar tissue formation. Okay, so we talked about how this can occur. Let's talk about how to get rid of it. Now, when you feel pain, I'm going to give you this is a generalization. When you feel pain, there's inflammation. Inflammation consists of different things. One is pain, the other is swelling, redness, heat. All right, so we're going to talk about this swelling aspect. When you have an injury and you've got inflammation, and you've got swelling, and you've got scar tissue formation, you can create sort of like this area of local hypoxia, which means you're not getting enough oxygen, which means you're not getting enough blood. So if that area can't get enough blood, it's never going to heal well. So we're going to try to push the swelling out of the area, take the swelling away so that blood can get in. So this is what the therapy is going to look like. Here's a muscle. There's the trigger point right there. I'm coming in and I'm pushing on it. And I'm holding it. And essentially what I'm doing is I'm pushing out the swelling. As the swelling moves away, so does discomfort. You know, just the fact that it's taking up space is uncomfortable. Not to mention that the inflammatory byproducts like lactic acid, like prostaglandins, those things that are irritating within the muscle. So I push that away, kind of make space. I'm also, this muscle, because it's feeling pain, it splints, it guards, it tries to protect. So it's tight. And I push and I hold, and that tightness kind of exhausts itself underneath the pressure. When I move my thumb away, we just create an open space. And what comes into that open space is blood. And so you get blood coming in. You've opened up this window of opportunity for healing, because blood brings your oxygen. It brings whatever nutrients that you're taking in. It brings in your white blood cells, which are what come in and clean up the broken edges of scar tissue and remodel. And it also pulls out toxins. Okay, so very simple treatment, but very powerful in terms of healing. So, any questions at this point? Because we're getting pretty close to starting. I'm going to hand out some household tools. Just reach in there, take one, anything you like. All right, he got the rolling pin. What do you like there? Tennis ball. A screwdriver. All right, wooden ball. It's one of my kids' toys. Golf ball. Hairbrush.
Let me ask you.
Please.
Okay, if you apply pressure point right there, you're saying you're passing it on. What are you passing on?
When I put pressure over the trigger point, what I'm doing is I'm squeezing the swelling out of the area, and the muscle that's tight because it's guarding against pain, it will exhaust itself under the pressure and it relaxes. And then there's a space where there used to be swelling and where there used to be a muscle that's tight and guarding, and blood can rush in there and heal.
Okay, but you're not passing it on and diluting it out into. That's what you're doing.
Yeah. Because as I push, what will happen is this fluid, the swelling fluid, gets moved out. It gets spread out into the surrounding tissues, and it has to be moved out by the blood as the blood comes in there.
So the blood flow sort of transports it.
Correct.
All the way out, so to speak.
Hopefully. You gotta make sure you're well hydrated. Move it out. You gotta make sure that you move afterwards, and that's where exercise comes in, and we'll talk about that too. Okay. All right. So each of you have household items. You probably got some of these in your own home. These are trigger point tools. Now we can use our hands, but they wear out. So these tools that you're carrying, they don't wear out. So you can use them to put pressure without wearing yourself out. And we have special tools for different parts of the body. So now we're on film. So I don't want to put people on film who might not necessarily want to be on film. So we're actually going to stop filming for just a second. Not a second. We're going to stop filming during this part where we're actually going over the trigger point work. And we'll start again when we start talking about exercise. So go ahead. So the idea is, with the trigger point work, we're going back over the basics. You look for points that are tender. You try to put the muscle that you're working on into its short, relaxed position. I'm going to use the example of the bicep. We shorten it. It should be relaxed though, so I've got to let it lean on something. And then I can push on those points, hold, wait for it to ease. Once it's eased by half, I could go through the range of motion, and that will help to tear loose any restrictions in that muscle's ability to move. And then I let go. In comes blood, in comes oxygen, in comes white blood cells, out go toxins. Healing. Window of healing. If you put ice on top of it after that, it leaves that window open even longer, so it decreases the swelling again, decreases pain, keeps things relaxed longer, and you'll heal a little more than you would if you didn't use the ice. You can repeat this process. I would recommend you repeat maybe twice a day at most, because you may bruise, like we said. You may bruise, you may be sore, so you don't want to overdo it. All right? Now, we're trying to get your function back. Like we had mentioned, we want you to be able to go through full ranges of motion. The less you move, the more pain you feel. The more you move, the less pain you feel. When you stop moving any joint, it will start to degenerate. Okay? So when you put in a splint, when you put in a cast, if you're not moving that joint, the muscles that move that joint will atrophy. They'll waste away. The joint itself will start to develop calcifications and scar tissue all around the joint, and you'll have decreased range of motion. If you've ever broken anything, if you've ever known anybody who has, when they cut that cast off, that limb is skinnier than the other limb because the muscles have wasted away. They can't move quite as far in their range of motion as before because scar tissue has developed and they may have some calcification going on. Well, the same thing happens to a lesser extent when you have these trigger points. You can't quite move as far as you should be able to. It's going to create a decrease in that range of motion. The muscle is injured. You can't strengthen an injured muscle. You can't stretch an injured muscle. So you need to get the injury away. Otherwise, you'll strengthen and stretch everything around it, but you won't strengthen and stretch the area that's actually injured. Okay? Makes sense? Okay. So I want to get people back to movement. So when we finish with, or as we're going through our trigger point therapy, the first thing I want people to do is just things that they want to be doing, whether that be work, whether that be some sort of activity like dancing, whether it be walking, whatever the case. I want you to move in ways that are enjoyable. We talked about how when you tear the scar tissue, scar tissue gets laid down randomly. It doesn't know where to go. It just goes in all over the place. When you tear down that scar tissue, when we're talking about trigger points, and then you use the muscle, then you're going to be using the functional parts of the scar tissue, and those that are restricting movement and not functioning will get taken away by the white blood cells as they continue to be able to enter. Right? It remodels, it cleans up the area, and returns your function. And then I want you to be moving. That's going to be the rehab. Okay? Rehab should be something that you enjoy doing, that you're going to be wanting to do anyway. And that brings us to exercise.
May I say one thing?
Yes, please.
When I came to you, I told you that I had carpal tunnel or something similar to that.
Right.
And you used the pressure points up here.
Right.
And it's gone.
Well, we're using physiology, and I'm so thankful that you are better. Your body does that. Your body heals. It's meant to do that. So what I know about carpal tunnel is that the carpal tunnel typically is not the problem, which is right this part of your hand. It's typically a trigger point or an adhesion to the nerve in the elbow, in the chest, or in the neck, wherever that nerve is crossing through. So I know that stuff. It's in my head. So I check, I checked here, you had a big trouble there. We worked on that until it healed. It takes away the symptoms here. Mm-hmm. And you heal. That's...
No operation.
No operation. Surgery without any blood. That's right. We're tearing down scar tissue. We don't have to open you up for that. I wanted to talk about exercise because now you've got use of your hands. So you were having trouble before. Now you can do your knitting. You can do the activities that you want to be doing with your hands. I have a lady, she couldn't do her clay work. She couldn't bake because her hands would wear out. So we worked on the muscles around her elbow. She can bake. She can knead the dough again. She can work with her wheel and create her pottery. That's rehab. Simple. When we talk about exercise, everybody should be exercising. Everybody should be exercising in some way. And it should be something you enjoy doing. And it should be something that is rhythmical and that you're increasing your heart rate. So I am talking about aerobic exercise. Anaerobic exercise can be good too, but aerobic exercise is therapeutic for your whole body. So I want you to find something that you enjoy doing that you'll want to do. So it doesn't have to be walking on a treadmill. It doesn't have to be going to the gym and lifting weights. It could be dancing. It could be swimming. It could be, you name it, basketball. It could be Tai Chi.
Tai Chi.
Right. There are many activities that you can do to get your heart rate up and be going through your natural ranges of motion, increasing your circulation throughout your body, and that has a a ton of health benefits. It decreases your stress. It increases serotonin. We talked about serotonin on the first day, or on the second day too. This was the happy hormone, remember? So it makes you feel better. Decreases depression. It alleviates anxiety, substance abuse, and ADHD. Increases your HDLs. Those are your good cholesterols. All right, that's what we want. We want to have high HDL, low LDL. Good ratio of that anyway. Exercise is what will increase your HDLs. So people can get their cholesterol low artificially using some sort of medication, but they can't artificially increase your HDL. You got to do something about that. Exercise. All right. It'll decrease your blood pressure. It's going to increase your insulin sensitivity. It'll make your insulin work better. So if you're diabetic, pre-diabetic, you need to exercise. It's going to strengthen your bones. Do you know that women have this trouble typically with osteoporosis? As you get older, not having the same amount of hormones, the osteoporosis starts to ensue. Well, you're also lighter. Your frames are lighter. So the number one recommendation is not Fosamax, not that drug that's supposed to help you hold on to your calcium. What the number one recommendation is weight bearing, exercise. So when you're walking around, you don't really have to think about weight bearing. Your legs are weight bearing. Your arms, however, you got to do something for that. So 3 pounds, 5 pounds, something light. Maybe it's lifting up a baby. You have to do that repetitively. So maybe your therapeutic activity, exercise would be going to the hospital, lifting newborn babies, making sure that they're being held and touched and loved. So maybe whatever the case is, it strengthens your bones. Bones strengthen with resistance. So you have to create that resistance. Obviously, it will help control your weight. It'll decrease your risk of gallstones. Helps control osteoarthritis. Remember we talked about moving? If you move, you've got sensors in your joints that will override pain signals. So if the more you move, the less pain you feel. You hit your thumb with a hammer, you're going to go like this, or you're going to squeeze it. And the reason why is because the movement will override the pain signals, or the pressure will override the pain signals. So the same thing is true when you're exercising. You may get to a point where you feel like, man, I hurt, I don't want to move, I'm just going to sit on the couch, I'm just going to lay down and wait till this pain goes away. Well, you may actually be extending your pain. If you start moving, you're going to increase your circulation, you're going to decrease your pain, and that will help you from degenerating. It will save you from the osteoarthritis. And it helps with fibromyalgia symptoms. That's the number one recommendation for people with fibromyalgia too.
What's the definition of fibromyalgia?
There is no definition for fibromyalgia. It's a garbage can diagnosis, meaning a person has a lot of pain, they've got a lot of fatigue, they may have some allergies, they've got a lot of things that just get thrown into a bucket and they say, you've got fibromyalgia. And the person who hears that says, oh, I'm so happy, now I know, somebody understands me. But they're not given any solution. It's like, okay, you get fibromyalgia. And then people identify with that. I have fibromyalgia. I had a patient, she had pain all over, like fibromyalgia patients have. She was full of trigger points. We helped her get over the trigger points, we got her exercising, we changed her diet, she was feeling great. She comes in, my elbow hurts. Oh, my elbow just really hurts. Must be my fibromyalgia. No, fibromyalgia isn't a disease. You can't catch it. Fibromyalgia doesn't go to the elbow. Fibromyalgia it's just pain and generally.
Is it just a word for inflammation?
No, it's not.
You wouldn't call that? Okay.
There's probably inflammation all over the place because they've got pain all over the place.
Can
No,
word?
inflammation is a good term.
Okay.
It refers to a bunch of processes that are going on, which, by the way, inflammation is good for you. When you first have an injury, you need inflammation or you won't heal. So it's an important part of the healing process, but it shouldn't last more than a few days. When you've got pain going on for weeks, months, years, that inflammation is not going anywhere. You've got a chronic problem and you need to be helped. You probably need some trigger point therapy. You probably need something else too that's going to kind of jumpstart your body into healing that area. Okay? Now, lastly, exercise will help decrease the risk for various cancers. So, lots of benefits for you. Now, I see patients all the time, they're not exercising because they're hurting. I'm hoping that this class will help you learn how to get rid of these pains so you can get active again.
Send them to Tai Chi.
Say that again?
Send them to Tai Chi.
Send them to Tai Chi. Yeah, Tai Chi is great for balance and for
Let me
strength.
add something.
Yes.
I've been to UT physical therapy a number of times in order to do some exercises to get rid of soreness, muscle soreness. And one time I mentioned to him, I said, this exercise helps me to get rid of this particular soreness. And he says, what you really need to do is you need to find something that helps you to exercise all of the muscles of your body, because every single movement that you make involves a number of muscles which are of different combination. And so he said to me, he said, Tai Chi is an exercise that's aerobic, and it is also something that helps you to exercise muscles in different combinations. So it's Tai Chi to me is more of an ideal, that is more of an ideal exercise than just going into a UT therapy place to do certain stretches or whatever, and also walking too. I mean, I think
Walking is my favorite aerobic exercise because you don't need any equipment for it.
right.
Tai Chi is great. You don't need equipment either. You just need to know how to do it. So there's a learning curve there.
Right.
But anything that's going to get the blood flowing throughout the body and using different muscles, walking's great. Even though you might not feel like you're doing much, you're moving those arms, you're getting the blood pumping, the legs are moving. All that is true. You need to move everything so that those muscles get used, so the blood pumps through them, and you stay healthy.
I can do a certain movement that I haven't done in a long time, and man, I feel it.
You're right.
Yeah,
Right. If you don't move it, you'll lose it.
yeah.
So it's good to be physically active. It's good to do a variety of different activities. I like to say start with walking, but go to things you enjoy that you're going to be happy about doing later.
Dance Russian dances.
Russian dances. Right.
Israeli
There's all kinds of
I
things
do
out there that are
Israeli
fun to
dances.
do that you'll continue to do if you enjoy. So next time I'm going to talk about hydrotherapy. Now I talked about using ice after using or doing the trigger point therapy. That is helpful to continue that window of blood flow coming in, healing occurring. That's hydrotherapy. I'm going to talk more about that and different ways of using hydrotherapy for different ailments, including pain. We'll talk about things like fever. We'll talk about ear infections. We'll talk about things of that nature, menstrual cramps. So I hope you all can make it to that one too. I'm going to repeat over here. You can get these video series for free by entering your name and email, texting it to this number, or going to CalebRunne.com and putting your information in there. And I hope these are helpful. I'm going to stick around here because some of you are new, and I want the new people to get a gift that we have for you. But I also want to have any people who have questions specifically about what we've talked about tonight or otherwise. I'll be here to answer. Thank you for your attention. Thank you for coming. So,
Thank you.
that's it. Anything else I should say?